So I hear we're seeing you for some very tired, sleepy eyes. Is that correct? Okay, let me just sanitize my hands real quick and we'll take a look at that. Besides the eyes, how you doing? Well, I hope by the time you leave this exam, you feel even just the littlest bit better. So, we have a little bit of paperwork to go through. Let me see right here. So first, would you mind just confirming your name and date of birth? Wonderful. And is that your preferred name? And how do you like to be addressed? Perfect. So, reason for exam, we have some tired, strained eyes. Okay. So, would you mind telling me a little bit about your symptoms? What all are you experiencing with the tiredness and the strain? Okay. Okay. Okay, that's a good list. And how long has this been going on for you? And on a scale from 1 to 10, with 1 being no discomfort whatsoever and 10 being the worst discomfort you've ever experienced, it's really interfering with everything in your life, how would you rate this discomfort or the pain? Okay. All right. Okay, so let me ask you a few lifestyle questions. This will help us better hone in on what we need to address and what we can change to help you. So how often would you say you are on a computer, like a desktop? Okay. And would you mind telling me a little bit about how that's set up? Where's your computer in relation to your eyes? How far up is it? Okay, and are you also experiencing neck pain, shoulder pain, headaches, anything like that? Whether it's due to the posture or it's due to looking at the computer? Okay. Okay. And are you often in air-conditioned or heated spaces? Whether it's, say, your work or it's your house, or do you frequent places that are like that? Okay. Okay, and do you have fans or vents that are directly blowing air around you, around your face, near your eyes? This could even be like if you are driving in your car quite a bit and the vents are pointed upwards towards your face. Okay. Alrighty. And how much time do you think you spend in a day on the computer, on your phone, on perhaps a tablet? Don't want to think about that too much, yeah. Yeah. And is there anything, any activity, or really anything of the sort that makes it worse? Weather, even? Okay, yeah. Yeah, I know what makes my dry eye symptoms a lot worse is when it is a very bright, cloudy day. Not sunny, I can handle sunny, but bright, cloudy days really just make everything hurt. Something about them. And is there anything that makes it better? Okay, yeah, resting your eyes, definitely. Okay. All right, very good. So that's it for my questions. Now we're going to be doing some testing. So just to make sure that there hasn't been any effect with your visual acuity, we're going to take it back to our Snellen chart here. So I am going to pop on my glasses for our testing here, and that'll help me see a little bit better. You can see up closer a little better. So we are going to take a little look at the chart. Now I'm just going to be pointing out a letter, and I just want you to tell me what letter you see. So if you could first cover your left eye for me. Very good, and let's just start at the top here. Let's start real easy. Right here. What is this letter? Good. And what about this one right here? Here. Very good, and let's jump down here. Let's do this one backwards. D, E, P, L. Good. And let's jump right here. And let's go right here. Good. 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 Excellent. And can we jump right down here, perhaps right on line 8? Let's go backwards. Good. Okay. So now we're getting a little out of view. So if you could just switch eyes for me. So cover your right eye. Good. And let's go ahead and start with number 3. We'll go forwards. Good. Good. Okay, and let's jump to number 5, and we will go backwards. Good. 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 And let's go to number 7 here. If we could do this, let's go ahead and do this one forwards. Good. 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 Yep. And brilliant. Now you can take your hand away from your eyes, and we will just go through this and do that with both of your eyes open. So we'll start at the top here. Number 1, this big guy right here. Good. Yep. Good. 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 And let's do this one backwards. Good. 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 And let's jump to number 5 and do that backwards. Good. Good. Yep. Okay. And number 6, let's do this forwards. Good. Good. Yep. Good. Great. And number 7 here. Good. Good. Yep. Good. And last one, let's do this one forwards. Yep. Good. Excellent. Wonderful. Terrific. Fantastic. And perfect. Excellent. So, I am pleased with the visual acuity part. So let me just note that down real quick. That I don't think there are any issues with your visual acuity. Wonderful. Now let's go ahead and take a look at the eyes themselves. So I am going to come in real close here, and I am going to be feeling around the eyes. I'll take a little look at them. Now, from this point forward, I will need to be touching you. Most of this examination does not involve very much touch, but for the inspection portion, I will need to be touching you. Is that okay with you? Do I have your permission to do that? Wonderful. Thank you. So let me get up a little closer here. I'm gonna get a little personal. And let's take a look at the eyes. So did you have any difficulty concentrating on the words on the Snellen chart? Did your focus kind of go in and out a little bit? Okay. Just taking a look. I want to make sure the eyebrows are intact while we're here. I want to make sure the eyelashes look good while we're here. Those are very important. They're not just pretty on a person, but they help catch any debris towards the eyes. Everything has a reason. Okay. And the tear ducts here. Okay, so those are definitely pretty red. And I am just going to be pulling down the skin around your eyes, and I want you to look up for me. Look at the conjunctiva. So I'm just going to very gently pull down. If you could look up for me. There we go. Okay. All right, and I'm going to be pulling your eyelids upwards. If you could look down. Okay. Look down. Good. I see. All right. You can do a couple blinks if you need to. Okay. So the sclera around the eyes, the whites of the eyes, that is definitely a little pink. Have you noticed that lately? Yeah, it looks pretty irritated. And the conjunctiva is definitely a little more flushed. So I can see that your eyes do look pretty dry overall. And there is definitely some irritation going on. But I just want to make sure that there's not anything more serious going on. Dry eye and eye strain is pretty common. It's very uncomfortable, but just want to make sure it's not part of something bigger. Okay, so I'm just going to take a last little peek here. Good. Okay. Alrighty. So let me just note my findings down here. Good. going to do some eye tests, and we're going to do this in a little bit of a sandwich, if you will. So with the dry eyes, the irritated eyes, the tired eyes, one thing that often can make it more uncomfortable is light shining directly into the eye. So I am going to sandwich the tests that I do with the light with tests that do not require any light, so I can give you a little bit of a break. Okay? All right, so first we're going to start with one of our favorites here. So this is called Follow the Finger. I'm going to test your eye tracking, make sure the muscles are moving correctly, that you can track my finger without any delay or any skipping. So I want you to focus on my finger here. Okay, train your eyes on my finger. And I want you to follow my finger using only your eyes without moving your head. Okay? So follow the tip of my finger here as best as you can. Ready? Okay. Go to the side, up, down, up, and to the side, up, down, good, and back to neutral, good. This is also sometimes called the H test because of the direction we move in, forms an H shape. Good. Good. Just want to test the cardinal directions of gaze. Now we're going to go in our diagonals. So we are going to go diagonally up. Good. Diagonally down. Diagonally down. Good. Diagonally up. Good. Diagonally up. Diagonally down. Diagonally down. And diagonally up. Good. And let's test the accommodation reflex. So I'm going to have you focus on our Snellen chart back here for just a second. Okay? And then I want you to look at my finger here. Good. And keep following it using only your eyes without moving your head as I come in and go out. Good. In. Out. Good. In. And out. Wonderful. And if you could look at the wall behind me here. Okay. And then look at my finger. We'll do the same thing. Right? We'll go in and out. In. Out. In. And out. Wonderful. Thank you. Yep, just go ahead and blink, rest your eyes for a moment. Wonderful. And let us move on to a special test called the Direct Consensual Response Test. Now, I am going to be taking my light and I am going to be shining it into one of your eyes. I'll have my hand up in between the two, dividing them. I'll shine the light into your eyes, and when I do, this one eye that I'm shining my light into should react to the light. And while that eye is reacting to the light, even though the other eye cannot see the light, it should react in the same way at the same time as the eye that is being shined into. So we have our direct response with the eye being directly shined into, and our consensual response with the eye that is not being shined into. Okay? All right, so I'm going to put my hand up between your eyes, and you just go ahead and just stare straight ahead. Direct. 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 Good. Consensual. 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 Excellent. And the other side. Direct. 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 Good. Consensual. 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 Wonderful. Go ahead and give your eyes a little blink. Rest them for a moment. And we will do another test that does not involve the light. We can do the little light sandwich. How are we doing, by the way? Doing okay? Okay. So now we are going to look at your peripheral vision a little bit. Peripheral vision, rather. So I am going to have you look at my nose real quick. Okay? And you're going to focus on my nose. I am going to have some fingers up at the sides of your vision. And I want you to tell me when you see them moving. Okay? You're going to focus on my nose, and using your peripheral vision, you're going to tell me when my fingers wiggle. Okay? All right. Good. Good. Mm-hmm. Mm-hmm. Good. Good. Mm-hmm. Good. Mm-hmm. Good. Mm-hmm. Good. Yep. Mm-hmm. Good. Mm-hmm. Good. Good. Mm-hmm. Good. Good. Mm-hmm. Good. Good. Mm-hmm. Yep. Good. Yep. Yep. Mm-hmm. Good. Very good. Excellent. So, periphery looks good. So lastly, we are going to do a fundoscopy. And that is a big word for a pretty small little test. So I have here, this is an ophthalmoscope, and this is what we use for our fundoscopies. Now, a fundoscopy is when I look into your eye and I look at the fundus of the eye in the back of the eye. So I will be flipping this on, and I will be coming in at the side, and I'll be looking around in your eye. I'll be able to look at the optic disc, be able to look at the little nerves there, make sure everything's good, or the blood vessels rather. I'll look at the blood vessels, and we'll just check on the back of the eye health. Okay? I will be putting my hand atop your head for this so that I know not to run into you. That helps me guide myself and keep you steady. Okay? So I'm going to flip this bad boy on, and let's start right here. So I'm going to put my hand on top of your head here, and we're going to do the best we can with my glasses. You know what? I'm just going to take them off. Sometimes it works, sometimes it doesn't. There we go. Very good. Okay. So what I'm doing here is I am searching for what's known as a red light reflex. And if I find it, then I can come in. Then I can take a look at the eye. I can look at the optic nerve. I can look at the blood vessels. Just make sure everything looks healthy. Good. Don't worry about blinking, that's okay. Just for a second. Okay, let's come back. And then we'll do that for the other side. So, put my hand on top of your head. And we'll search for the red light reflex. Okay, and then we come in real close. Good. Trying to make sure I don't run into you. Going very slow, so even if we did collide, it would be a very soft collision. But even still, it's not very professional to knock into your patients. Accidents happen, though. Good. Okay. Alright, I'm not seeing anything noteworthy, which is good. Okay, we'll come back. There, not too bad. Yes, the fundoscopy sounds a little medieval, but really it's very quick, absolutely painless procedure. So, based on the results of our tests here, it looks like visual acuity is good. We don't have to worry about that. Don't have to worry about special eyeglasses or anything like that. Don't have to talk about that. Just good. And definitely some dryness and irritation in the eye. So, other than that, I did see just a little bit of sluggishness when we were doing our different tests, but eyes, they can get pretty strained. I mean, we are well aware of the concept of muscle strain with our arms, with our legs, but our eyes it's kind of an odd feeling when you're essentially pulling a muscle, but it's your eyes. It feels very strange. So definitely I can see the strain in that, but the actual health of the eye looks pretty good. So I'm not too worried about something else going on. I think we're just dealing with some garden variety dry eye. which luckily there are quite a few things we can do. So I'd like to discuss some different treatment options. A lot of these are just mostly little lifestyle, not even changes, but tweaks. Basically, they're very, very easy to implement, and they make a world of difference. So firstly, we want to reduce the digital time, right? The more we look at screens, the worse it's going to get, especially because when we look at screens, we happen to blink less, actually. And that's a big part of it, is that when we're blinking less, we're not lubricating the eye as much, right? So, and this can definitely be a huge number on your eyes as far as strain goes, especially when we're looking at things that don't have very good contrast, or maybe the brightness isn't quite right. Is your computer way too far away? Is it too close? These kind of things. So reducing the time we spend in general is a good thing to do. Now, when we have our occupation that is reliant on our computers and our phones and whatnot, then we can do little tweaks there, make sure that our desk setup is working for us as far as posture goes. It's close enough to the eyes. We're having good brightness, things of that sort. And next thing, so this is a little, I don't want to say controversial, but some people swear that blue light is the root of all sin. Some people say that blue light really does nothing. Now, anecdotally here, so you take it with a grain of salt, I adore blue light filters on my digital devices. I notice an immediate difference when, let's say, I turn on my phone and that blue light filter gets turned off and I have to turn it back on manually. Immediately when I look at my phone, my eyes are just crying for help. They're like, this is what I put up with for years and years before this filter. And then afterwards, when I put it back on, my eyes relax so much more. So I haven't really noticed a difference in, say, like my tablet usage. If I'm reading, that I just mostly use dark mode for, which is also easier on my eyes, anecdotally. But on my desktop, certainly I also use a pretty heavy blue light filter. So that might be something to just try out. I mean, it's a button you can flick on and off. If it works for you, that's great. If it doesn't work for you, not a big deal. So that's something for you to try out. Another thing is keeping light from shining directly into your eyes. So adjusting our lighting a bit. If we are reading, for example, having a light that's coming from behind us and shining directly on what we're seeing will help reduce that strain, and it'll also keep that light from shining into our eyes. And if we have something, let's say, at a desk, we could have where it's shining at our workspace, whatever we're working on. You basically want to adjust things so nothing is shining directly into your eyes as much as possible. And that's also part of the computer or mobile device thing, is that's a lot of light that's right in the eyes. Another thing is we want to take some breaks, and we want to make sure to blink often. So blinking is essentially unconscious until you realize that you're blinking, and then you're kind of like, wait, how does that go? Blink, what kind of rhythm, that kind of deal. But if you could be a little more conscientious to blink more often, that would be a really good first step, so that we can lubricate the eyes a lot better. And another thing, if we are still having to work on computers or phones, things of that sort, taking breaks pretty often would help quite a bit as well. So there is something called a 20-20-20 rule. So every 20 minutes, look at something 20 feet away for 20 seconds. So those muscles will adjust a bit. That gives your muscles a little break, strengthens them a little. It's real simple. I mean, every 20 minutes, 20 seconds. Look at something 20 feet away. Not a big deal. Easy to adjust, but that will also help quite a bit. I noticed anecdotally that when I started doing that, I definitely had a noticeable amount of reduced strain on the eyes when they were getting a little bit more of a workout, really. So if I'm working through the day, sometimes I will just get up and go do something else for a little while and vary what your eyes are looking at so they're not stuck in one position for a very long time. It also helps that I have ADHD, so I need to vary what I do or my focus is just, And another thing we can do, and this will help with the lubrication, is you could do a hot compress or an eye mask 5 minutes twice a day. So you could do this with, say, a washcloth. You could get this as hot as you can stand it. So we want to make sure we're not burning the eyes, but it definitely should be pretty warm. So cover this in warm water from the tap or however you have that water, and make sure to test it so that it's not too hot. And put it over your eyes, and you can hold it if you want. That might help a little bit, but if it's too hot, that'll put a little more heat on there. And you want to do that for 5 minutes twice a day. You might have to run this under the water a couple of times because it will cool down pretty quickly. And another option you could do is a microwavable eye mask as well. So this little guy can either be chilled or it can be heated up. So I put this one in for 10 seconds, rest 5 seconds, and then it is perfect. So you can do one of these guys and rest for 5 minutes. And that will definitely help. It helps stimulate the oil glands in the eyes, which help produce the lubrication for your eyes. It also gives them a minute to relax as well. And especially with that washcloth, that may help with getting some moisture in there. And lastly, we can always look at artificial tears as well. So eye drops. Now, some people find that eye drops with preservatives will irritate their eyes further if they use them more than a few times a day. So that would be something you may have to look into. Personally, most solutions are toxic to my eyes because my tear chemistry is toxic to my eyes. That's kind of a fun one when your eyes are literally poisoning themselves. But I have to use very special drops, no preservatives, what have you. So I don't think you're quite on the level of that. You should be able to use some regular eye drops. But definitely look into that. If you think you might get a little more irritated, then maybe avoid the ones with preservatives. And they come in small enough bottles that if you're using them at least a couple times a day, you won't run into them expiring on you. Okay, I think that's about it. It's a lot of different little bits. So there are some again, like anecdotal evidence that getting more omega-3s in your diet can help a lot. So taking fish oil or eating more fish. If you eat more fish, then that may help as well. So that's just up to you. I haven't noticed too much of a difference that way. Some people swear by it though, just like the blue light filter. So do you have any questions for me? Yes, that was indeed a lot. Luckily, I have a little handout for you that outlines all of these different things so that you don't have to remember everything I just said. Okay? Wonderful. Anything else? Very good. Okay, so let me go ahead and pop these off. Then we'll look pretty again. And let's grab that handout for you. Okay, so this is for you. And I think since we've been working on this dry eye thing, I'd like to see you back in 6 months. We can just check if there's been improvement or if there is a more, I don't want to say aggressive, but a next level that we can do to address the eye strain and the dry eye. Okay? Alrighty. Thank you so much for coming in today and getting this appointment with me, taking a look at your eyes. I really appreciate it. I hope you have a whale of a day and a good rest of your night. Thank you. Bye now.
Thank you so much for watching this video. I really appreciate it. I create primarily medical, alternative medicine / pseudoscience, and personal attention ASMR roleplays. If you want to check out a specific category of my videos, my channel playlists have everything from sci-fi to historical to even fantasy videos. If you want to support my work, consider checking out my Patreon profile in the description box, where I offer early access to